Chronic pain and chronic recurring injuries has been a challenge for therapists for as long as we can remember. If you come from the medical world, we are trained to look at symptoms and then using the symptoms to make a diagnosis. And once you have the diagnosis, you have a treatment available. But what when the client keeps coming back or the patient keeps coming back with the same old injury, or they come back with this week it's the shoulder and next week it's the knee and the next week it is the hip, and they haven't fallen, there's been no specific trauma, it's not acute, it just happens spontaneously, it comes from nowhere. And those are the injuries that's such a challenge because it's no use diagnosing them. So in the 90s, while working with professional sportsmen, I started to ask a lot of questions because I was so frustrated with all of this. And then I started to look at the body holistically, and I decided to test the movement, test the mobility of the whole body. So I started with the neck and I went all the way down to the toes. And with all these clients with chronic and recurring injuries, I found areas in their body that is very immobilized, where they can't move properly. And everything inside that area, embedded in that area, is entrapped in this immobility. And that entrapment causes the symptoms, and not necessarily where it's entrapped, but it causes symptoms somewhere else because we need overload somewhere else because we do not have the function or the movement in the areas that are immobilized. So it could be that your shoulders got immobility and then it causes issues in your opposite knee or your opposite elbow or in your lower back or in your neck. It's important to find the source of the injury, and the source of the injury is always sites of immobilization. And if we then deal with the areas of immobilization and free it and connect it back to the body, that is where we solve the chronic injuries and the chronic pain.